Hello guys, so now we shall be discussing about intercostal nerves. Okay, so our topic of discussion would be about intercostal nerves. Intercostal nerves. Okay, so when I discuss about intercostal nerves, first of all you have to know how many pairs of intercostal nerves we have got. Why I am calling it as pairs? Because the intercostal nerves are symmetrically and equally they are distributed on both the sides. So how many pairs of intercostal nerves? So I've got 12 pairs of intercostal nerves. 12 pairs of intercostal nerves I've got. Okay. Now first of all we'll see how does a typical intercostal nerve look. Okay. And after that we're gonna discuss the important things and the clinical aspects which we are need to be discussed here, right? So coming to the important clinical point. So if you look at the spinal cord guys, so let me draw and explain you a typical intercostal nerve, how does it look. So if you look at the spinal cord over here, so this is your spinal cord. And all of you know very well one thing, that spinal cord is divided into two important parts, right? So what I am doing is that I will imaginarily divide the spinal cord into two halves, okay, like this. If I divide it, all of you know that the upper part is called as the posterior part. This is a posterior part. The lower part is called as the anterior part. The posterior part is also called as the sensory part, right? And the anterior part is also called as the motor area or the motor part. Why it is called as sensory? Why it is called as motor? Because on the top, on the posterior side, only the sensory neurons are there. On the anterior side, only the motor neurons are there. That is why it is called as sensory, and that is why it is called as motor. Okay, right. So if you look here, right, that this is a cell body, this is the axon, right, and it has got a central process all the way down here. It has even got a peripheral process like this, central process and peripheral process in this way. Okay, so let me move this entire picture aside like this. So one is a central process, another one is a peripheral process like this. Now coming to this one also, that is the motor neuron. Here also you have got this neuron like this. Now the sensory neurons and the motor neurons, right, sensory neurons and the motor neurons, all of them are joining into this, right. See here, both of them are joining into a particular sheath like thing here. So this sheath like thing, whatever is there, this is called as a spinal nerve. So where are they joining? They are entering into the spinal nerve. And all of you know that spinal nerve divides into two important parts like this. What are those two important parts? One is called as a dorsal rami, another one is called as a ventral rami or anterior rami. Okay, so let us say that there are some thousands and thousands of bundles of these nerves. What? These sensory nerves. In the same way, there are many motor nerves like this. So what will happen is that spinal nerve is a mixed nerve. Why? Because it is having both sensory as well as motor. So some of the fibers, they go down like this. Some of the fibers, they go up. In the same way, some of the sensory fibers also they enter down like this, and some of the motor fibers also they go up in this way. They go up in this way. Okay, whatever it is. So we have got a posterior rami, we have got an anterior rami. Now I'm using another color representing both of them. So from the posterior rami, you have got a nerve that is coming out like this. This is called as posterior primary ramus. What is this called as? Posterior primary ramus. And not to forget that this is your dorsal root ganglion. Okay, see this part over here is your dorsal root ganglion. Don't forget this. This is your dorsal root ganglion, right? So whatever it is, posterior primary ramus. Okay, now what will happen to this posterior primary ramus? This posterior primary ramus is dividing. It is giving out a branch all the way down like this. Okay, right. When I tell posterior primary ramus, there should also be anterior primary ramus, right? So let me draw this anterior primary ramus over here. So let us say this part which I am coming down, is called as anterior primary ramus. Okay, or the other name for this anterior primary ramus is also called as anterior intercostal nerve. Okay, so this is your anterior, this is your anterior primary ramus. Anterior primary ramus, or also just called as an intercostal nerve. Intercostal nerve. Okay, now what will this anterior primary ramus do? What will it do is that it will give out two branches. See, there is one branch that is giving out like this. There is one branch that is giving out like this, and there is an other branch also that is giving out like this. Okay, so what is the name of this particular branch over here, guys? This is called as lateral cutaneous branch. What is this? This is called as lateral cutaneous branch. So when there is lateral cutaneous, there should also be anterior cutaneous. So this is called as anterior cutaneous branch. So if I ask you, what is this? What is the course of this anterior primary ramus? It is dividing into two branches, lateral cutaneous as well as anterior cutaneous branch. Now this lateral cutaneous branch divides like this. So one end of this lateral cutaneous goes all the way like this, and what is happening? It is anastomosing with what? Posterior primary ramus, and the other end where it is giving an anastomosis all the way to your anterior cutaneous branch. Okay, so this is a typical intercostal nerve. What is this? This is a typical intercostal nerve. Why am I drawing this picture? Is that later on I will tell you one very important clinical point, which is all that I am asked here, right? So this is an important thing which you need to know, right? Apart from this, what is the other important thing which you need to know? From T1, the spinal nerves from T1 till T11. How many pairs of spinal nerves I told you? 12 pairs. In these 12 pairs, T1 till T11, these 11 pairs of spinal nerves are called as intercostal nerves. Okay? They are called as intercostal nerves because they stay in the intercostal spaces. But T12 is called as subcostal nerve. Why? Because T12 from the thoracic, it enters into the abdominal region. That is why it is below the ribs. Abdomen is below the ribs, right? So you call it as subcostal nerve. Sub in the sense below, costa in the sense ribs. So subcostal nerve. So T1 till T11, these spinal nerves are called as intercostal nerves, whereas T12 pair, the last one is itself called as a subcostal nerve. So let us write it down now, that T1 till T11, these spinal nerves are called as intercostal nerves. Okay, and T12 itself is called as a subcostal nerve. T12 itself is called as a subcostal nerve. Now, basically in the textbook there is a classification of these intercostal nerves. There are two different types of intercostal nerves. One is called as typical, another one is called as atypical. Okay. Classification of intercostal nerves. So what is the classification of intercostal nerves? Intercostal nerves are classified into two different types. What are these two different types? One is called as typical, another one is called as atypical. Okay, one is called as a typical intercostal nerve, another one is called as atypical intercostal nerve. What is typical and what is atypical intercostal nerve? Typical intercostal nerves are third, fourth, fifth and sixth. Why are they called typical? Because these nerves, they supply the intercostal spaces and the thoracic wall only. Okay, so these nerves, they stay in the thoracic region. They supply intercostal spaces and the thoracic wall. They do not come out of the thoracic cage. It means they do not come out of the thoracic cage into the abdominal region or any other region. They are staying only within that closed boundary of thoracic cage. So that is why they are called as typical. But if a nerve is supplying the thoracic cage and also coming out of the thoracic cage and supplying elsewhere, you call this as an atypical atypical intercostal nerve. Okay, so typical intercostal nerves are the nerves that supply intercostal space and thoracic wall only. Okay, so what are the atypical nerves other than this? What are other than this? The first one, second one, and we have got 7th, 8th, 9th, 10th and 11th. Okay, so what do? They extend beyond the thoracic cage. Okay, they extend beyond the thoracic wall and supply other regions. They supply the other regions. So if they are extending beyond the thoracic wall and supplying other regions, can you tell me few examples of where they are supplying? For example, if you look at the first intercostal nerve, if you look at the first 𝐼𝐶N in the sense intercostal nerve, okay. So if you look at the first intercostal nerve not only supplies to a thoracic cage but also supplies other regions outer than the thoracic cage. For example, first intercostal nerve will continue as the nerve in the brachial plexus, that is, it will continue as a lower trunk of the brachial plexus. So lower trunk of the brachial plexus in the sense it is the nerves that are supplying your arm, it is outside the thorax. So as per the definition here, it should supply the thoracic wall and other regions outside it. So it means brachial plexus. So it continues as the lower trunk of brachial plexus. Okay. Second important thing, that is the second intercostal nerve. Okay. If you look at the second intercostal nerve, what is it to deal with the second intercostal nerve? Second intercostal nerve has got one small branch that is called as a lateral branch. Okay, lateral branch. The other name for this lateral branch is intercostobrachial nerve. What is the other name for it? Intercostobrachial nerve. So where does this intercostobrachial nerve supply? It supplies to the thorax. Okay, other than the thorax, where does it supply? It supplies to the skin of the axilla. It supplies to the skin of the axilla. Not only that, it even supplies to the medial surface of the arm. This is the upper arm. Upper arm. In this upper arm, we have got this surface as a medial surface, this surface as the lateral surface. So it supplies the medial surface of the upper arm. Okay, it also supplies medial surface of upper arm. Right. Any clinical point which you can tell? Yes. So what I am trying to tell you is that this second intercostal nerve, here it will be in the second intercostal space. From here, this nerve first supplies the thoracic region and then this nerve goes like this, supplies the skin of the axilla, and also it gives a branch that supplies to the medial side of the forearm. Medial side of the upper arm. That is the reason why whenever you have myocardial infarction or chest pain, patients will complain that the chest pain is radiating to the left arm and all. Why patient will complain chest pain referring or radiating to the left arm here? It is because of the irritation to this nerve. Got it? Right. So what you need to know is that because of this important point itself, this is why the cardiac pain is referred to the left arm. Cardiac pain is referred to the left arm. This is a very, very, very important statement to remember. Very important statement to remember. Right. Next, when it comes to the remaining, what are those remaining? So we are done with the first, we are done with the second. Now coming to 7th, 8th, 9th, 10th and 11th. So all the way, all these from the 7th till the 11th intercostal nerves, 7th till the 11th intercostal nerves, all of them From the thorax, they enter into the abdomen and supply the abdominal region. So from the thorax, if they are entering into the abdomen, can I call them as thoraco-abdominal nerves? Yes, they are all called as thoraco-abdominal nerves. Okay. Now these thoraco-abdominal nerves, where do they supply? They supply the muscles of abdomen. They supply the muscles of abdomen. For example, they supply your external oblique muscle. They supply your external oblique muscle. They supply your internal oblique muscle. They supply your transverse abdominis muscle. And they also supply your rectus abdominis. Rectus abdominis. So how many muscles of the abdomen we have got? In the abdomen we have got external oblique, internal oblique, transverse abdominis and rectus abdominis, right? So this supplies to all of them. Right. Now what is a clinical point which you can tell here? So before I tell a clinical point, let me just fastly draw up the picture which I have already drew before. Okay. So what is that picture is that? All of you know that this is a centrum and this one over here is your spinal canal. So all of you are aware of this picture, I think. Again, I am drawing the spinal nerve over here. Okay. And down over here, you have got your sternum like this. This is your sternum. Okay. And obviously, I'm not going into much detail. I'm just drawing the lines over here. So here, right. So this is the nerve which you know. Now what I am telling you is that all of you know what is TB, tuberculosis. Tuberculosis is not only limited to the lungs. TB can even go to the brain. TB can even go to the spine, anywhere in the body. Okay, these are called as extrapulmonary manifestations. So TB, if it goes to the spine, this is called as what? This is called as spinal TB or pot spine. You call it as pot spine. So whenever the TB is going to, let us say, the vertebra and all, so there also there will be pus formation which will be seen. But this pus formation, normally an abscess will be hot, it will be tender. But this abscess is not hot, not tender. That is why such kind of abscesses are called as cold abscesses. So cold abscesses are formed in the spinal vertebra, right? Not only spinal vertebra, even if they are formed in the spinal vertebra, from the vertebra, these cold abscesses will migrate to different locations. For example, these cold abscesses can enter this particular area. What is this particular area? See, this yellow color part which I am drawing right now is a cold abscess. Okay. Cold abscess of what? Cold abscess of a TB. That is why it is called as tuberculous cold abscess. So this tuberculous cold abscess, where is it? It is located on the adjacent side of the vertebra. On the adjacent side of the vertebra here, what are the muscles do you have, guys? The muscles which are located here are called as erector spinae. So can I tell this cold abscess is formed near the erector spinae muscle? Right? Second important thing, cold abscess is also exactly formed here near the lateral cutaneous nerve, right? So this place is the place of your mid axillary line. So this is the place of your mid axillary line. Next, cold abscesses are also formed just lateral to the sternum. This is the sternum on either sides, just lateral to the sternum. So three locations where the cold abscesses are formed. Where are these locations? So the first important location is near lateral to erector spinae. Okay, and here it is in the mid axillary line, and finally here it is lateral to sternum. So these are the three important locations, right? So these are the three important locations where these cold abscesses are formed. Okay, so what are these? These are cold abscess. Cold abscess are formed in these locations over here. Okay, so this is one of the very important thing which you need to know, guys. So let me just recap the things which we just spoke right now. Okay, So what are the important things we have just spoken here? We discuss something about intercostal nerves. How many pairs of intercostal nerves are present? There are 12 pairs of intercostal nerves. Okay. So in these 12 pairs of intercostal nerves, this part which you can see over here, this part is called as your spinal nerve. This spinal nerve is dividing into two parts. One is called as, this is the posterior ramus of the spinal nerve, and this one is called as the anterior ramus of the spinal nerve. So posterior ramus, anterior ramus is also called as intercostal nerve. Okay. So anterior cutaneous branch, lateral cutaneous branch, and you can very clearly look at their anastomosis, right? So these spinal nerves are called as intercostal nerves. Which spinal nerves? T1 till T11. And next, T12 alone is called as a subcostal nerve. Coming to the classification, 3rd, 4th, 5th, 6th is typical, and 1 till 11, the other numbers are atypical, right? So atypical in the sense, the first one supplies the lower part of the brachial plexus, second one is called as the intercostobrachial nerve, right? I told you, remember this, cardiac pain is referred to the left arm. Why? It is because of the second intercostal nerve. 7 to 11, that is thoracoabdominal nerve. And these muscles, I think it is not important to remember these muscles, because all of you know, just know that thoracoabdominal will supply to the muscles of the abdomen, right? Cold abscesses, where are these cold abscesses seen? Mainly in case of TB. In case of TB, the patient will have pot spine. Pot spine. Pot spine in the sense, TB of the vertebra is called as pot spine. In that case, the cold abscesses are formed. These cold abscesses, what do? Yeah, these cold abscesses are formed in three particular locations. One is lateral to erector spinae, mid-axillary line, and lateral to sternum. Okay. So these are some of the very important things which you need to know regarding the intercostal nerve, guys. Thank you so much for watching my video. Goodbye.